So this is a loading technique to the lower part of your back, either the left or right side. So what you're trying to aim for is roughly where the ribs end to roughly where the belt line begins. So this area on the left side or on the right side. What you're going to need is a roller just like this. I prefer using a roller versus a ball because this one's a little bit more forgiving. When you put your body on the roller, you're going to be angled a little bit more on the side. My hip is on the floor, the roller is on the target tissue, and my elbow is going to be down to give me some support. So what I'm going to do with my opposite knee bent, this is going to help me maneuver up and down. So I'm going to go down towards my hip, and then I'm going to roll it up towards the lower part of my ribs. Wherever it's sensitive, I'm going to hold. So right now my body is slightly angled backwards about 20 to 30 degrees, trying to figure out where that most sensitive area is, which is right there for me. So the technique I can use is number one, the seek and destroy. So I'm finding the area that's sensitive, which is right there. I'm going to hold it. Now I'm going to destroy it by applying some load directly on top. So what I'm going to try to do is take pressure off my elbow, so most of the load and weight will be distributed directly on this roller. And just lean into it a little bit more. I'm going to just take a breath in and out to allow my body weight to drape over that roller. Once that desensitizes or becomes a little bit more tolerable, then I can find another area. I'm going to hold it there. I'm going to take a breath in, exhale all the way, allow my weight to drape over that roller until it desensitizes. So right now, like I said, I'm slightly tilted back about 20 degrees. What I can do is I can shift my body forward a bit, so roughly about perpendicular with the floor, or I can lean back even further. So instead of being 20 degrees back tilt, I can tilt it back about 35 to 40 degrees until I feel the tissue that's sensitive and hold it there. The second technique I can do is more of the pin and stretch. So I'm going to do the exact same thing. I'm going to find the area that I need to work on, which is sensitive. I'm going to hold that position. What I'm going to do is I'm going to try to stretch it out a little bit more. So with the weight applied into the roller, I'm going to try to straighten out my elbow so I side bend the opposite way of the roller. So I'm going to hold that position. I can use this hand, place it on the knee that's bent, and grab and pull, just as long as my body is in contact with the roller with the same amount of intensity. So again, what I'm going to do is I'm going to apply that pressure into that target tissue, hold it there with the same amount of weight. I'm going to grab my knee, and then I'm going to try to pull with my arm on my knee so my body tilts up, and I'm going to use this other hand that's on the floor and help it out by pushing it up a little bit more. So what that's doing, it's stretching out that tissue, that target tissue, while it's applying some pressure on that roller. So I'm going to show you in this position. So again, I'm going to find the target tissue, which is roughly there. I'm going to grab my knee. I'm going to pull it up slightly, use my other arm that's on the floor to assist me. And this is as far as my body wants to go before I actually lift up off of the roller itself. So again, the whole intent is number one, making sure that I apply pressure into the foam roller. The second part is to try to stretch it out.